What are your thoughts on like when to involve an endocrinologist versus like when do you think you can just manage it on your own?
Good question. I think that, I am personally, very quick to involve our endocrinology colleagues as well too, especially in those that are borderline diabetics as well too, and just letting our endocrinology colleagues know early to help us manage that hyperglycemia as well that's associated with it as well, because it can occur fairly quickly in many patients as well too, alongside with diarrhea as
Yeah.
well too, and the two can go hand in hand together as
Right.
well too. So that's something we need to keep in mind as well too.
Definitely.
Yeah.
And I think in the advent with like having CGMs down the road, hopefully with more adaptability, I think that will be also one step ahead in like
Definitely.
monitoring and being more proactive and, you know, managing the side effects proactively rather than reactively. Yeah. What are your key takeaways from the session?
I would say the key takeaways from this session really would be that the Inava 120 did show overall survival and is a very viable option for our patients essentially that have progressed on adjuvant endocrine therapy as
Right.
well too, in that timeline as well too. So it is something we should be discussing with our patients in that setting as well too. The other things in terms of the Veritech trial, in terms of a new sort of PROTAC degrader
Right.
that is also a very viable option for folks essentially, and then really, waiting for that Serena 6 data as
Yeah.
well too, and exactly how that sort of impacts exactly how we think about molecular
Yeah.
relapse as well too, within breast cancer and acting on an ESR1 mutation without imaging versus, the opposite of what we do as
That's
well
right.
too, and whether we routinely test these
Yeah.
individuals, for ESR1 mutations as
Yeah.
well too. I'm not sure exactly we're there yet, but I think that this data, I think, will really push us one way or
That's
the
true.
other.